I was a part of a talk on the recently approved anti-obesity agents. So since 2012, there have been 4 drugs approved by the FDA for managing obesity. There's lorcaserin, which is a serotonergic agent, and phentermine and topiramate, naltrexone and bupropion, as well as liraglutide. So a couple combination products, as well as a couple new agents. There's really a central and a peripheral system that's involved in terms of modulating feeding behaviors, the desire to eat, affecting satiety, as well as energy expenditure. And so lorcaserin primarily works basically in the hypothalamus. Many of these drugs work in the hypothalamus. Phentermine's a little bit different. It does have some effects in terms of encouraging stored fat to actually burn energy. And so these drugs, as a result, have quite a number of side effects related to the central nervous system because a lot of them act in the hypothalamus and affect that region of the brain. So it's all over the place. Definitely dizziness, headache. Some of them can affect anxiety and irritability, particularly phentermine because it is a stimulant medication. It's a sympathomimetic amine, meaning that it's going to increase the release of catecholamines such as norepinephrine and epinephrine. Patients get a lot of energy from it. Very similar with bupropion, which inhibits the reuptake of norepinephrine. So as a result, that abundance of norepinephrine can definitely lift mood a little bit, but that can make some patients anxious or irritable. I think when we're looking at these drugs, they're really adjunct to intensive lifestyle therapy. If you look at the data available, these agents achieve the weight loss reductions in the studies because they're combined with intensive lifestyle change. And I think it's really important to note that they are adjunct and should not be treated as the first line option in terms of managing obesity. There are some obesity guidelines available, and they recommend that drug therapy is appropriate or reasonable to consider in patients with a body mass index of 27 or greater that have at least one additional risk factor. So that would include hypertension, dyslipidemia, or diabetes. In patients with a body mass index of 30 or greater, then it really wouldn't matter about the additional risk factor and that the drugs would be reasonable. One thing to note is that you're really looking at a 5 to 10% weight loss. And so if your patient's personal goal, say, is to lose 100, 150 pounds, you have to be realistic in making sure the patient understands that these drugs are not going to get them there. It's going to take some permanent lifestyle changes to achieve such a goal. From the cardiovascular perspective, there's a lot of skepticism and concern based on prior experience with fenfluramine, which increased the risk of valvulopathies and pulmonary hypertension. With that said, from a cardiovascular perspective, it's clear that obesity is a major contributor to increased risk cardiovascular disease. What the cardiovascular community is going to want to see is data showing that these drugs are safe in patients with heart disease. And right now, the currently available data, those patients typically are not enrolled in these studies. And so there are some trials underway. So particularly with lorcaserin, the Camella-TIMI study, which will be out in 2018, will hopefully provide some insight. And once we can see if these drugs are safe, then I think you're going to see the possibility that the cardiovascular community prescribes them. But I think ultimately it's still going to be your internal medicine and primary care docs and your endocrine docs that are going to be primarily prescribing these drugs. For these drugs, there have been several studies looking at their ability to prevent or delay the onset of diabetes, and there is some pretty good data available that they can reduce or be helpful in patients with prediabetes. There are some improvements in blood pressure as well as the lipid profile. So there's the possibility that these agents may affect all of those risk factors and maybe offer cardiovascular benefit, but clearly we're going to have to wait and see what the data shows.